Gentlemen, quick reality check. Most men notice breasts, but very few men know how to turn that attention into real pleasure and emotional connection. You've probably spent more time thinking about technique you saw online than about the one thing that actually matters: consent, rhythm, and care. If you want to be the kind of partner who makes her melt, relax, and feel deeply desired, stay with me. I'm Dr. Jocelyn, a urologist and men's health specialist with 5 years of clinical work, and in this video, I'll give you a respectful, science-backed yet practical playbook for approaching breast touch in a way that honors comfort, boosts arousal, and can, for some women, be genuinely orgasmic. Before we begin, if this kind of content helps you, please hit like, subscribe, and drop a comment. Where are you watching from? It helps us reach more men who want to be better, not just louder. First, let's clear the air. Myth: breast touching is instinctive, just grab and go. False. Breasts are highly sensitive, emotionally meaningful, and for many women, they're part of a larger sexual system. Approached without consent or awareness, what you mean as intimacy can feel uncomfortable or invasive. But approached with intention and feedback, breast touch becomes an incredibly intimate, connective, and for some women, orgasmic experience. Why? Because arousal isn't just mechanical, it's biological and psychological. Blood flow, nerve sensitivity, hormonal signals, and emotional safety all combine. So the technique isn't a single move, it's a pattern. Ask, attune, pace, support, and respond. A quick introduction. I'm Dr. Jocelyn Urology, Men's Health, 5 years in clinic working with men and couples on intimacy concerns, erectile function, pelvic health, and relationship-related sexual issues. What I've seen over and over is that the men who do best are the ones who focus on communication and the overall sexual ecosystem, not on a single hack. This video is about making breast touch an informed, respectful, and effective part of your intimate life. I'll walk you through 9 practical tips that explain the biology, what's happening in the body, the emotion, how it affects dignity and quality of life, and the practical what it looks like day to day. Before tip 1, consent. Always. Get a clear yes, be prepared for no, and respect it without drama. That single choice transforms the rest of the experience. If you appreciate clinical, no-nonsense advice delivered with empathy, hit subscribe and ring the bell. Okay, let's go. Tip 1, start with consent and curiosity. One simple question changes everything. Biology. When someone feels safe, the parasympathetic nervous system, the rest and digest branch, can engage, lowering muscle tension and allowing better blood flow to sensory areas. Emotion. A verbal check-in reduces anxiety and increases trust. Trust raises oxytocin, the bonding hormone, which amplifies pleasure and emotional closeness. Practice. Before you touch, ask a short present tense question. Do you like breast touch, soft or firmer? Use a simple color code if you want: green, more, yellow, gentler, red, stop. That single sentence lowers guard and gives you permission to explore. If she says yes, proceed slowly. If she says no, smile, accept it, and move to another form of intimacy. Tip 2, start wide, move inward. Don't rush to the center, let her nervous system switch on. Biology. Sensors across the chest and torso respond to progressive stimulation. Starting broad warms the skin and increases circulation. This preps the more sensitive areola and nipple area safely. Emotion. Starting wide communicates care. It feels less invasive and more sensual. It lets anticipation build rather than forcing it. Practice. Begin with open-palmed, broad strokes across the upper chest, collarbone, and outer breast tissue. Use slow, deliberate contact, think cradle, not poke. Layer in light kisses to the neck and collarbone to create context and warmth before moving to the core areas. Tip 3, cradle, don't pinch. How you hold matters more than where you touch. Biology. The breast is soft tissue with a lot of nerve endings. Unsupported tugging can be uncomfortable and even strain connective tissue. A supportive hold helps her feel steady and secure, encouraging relaxation and arousal. Emotion. A confident, caring hold, like cradling rather than pinching, communicates tenderness and respect. That emotional tone is a huge amplifier for pleasure. Practice. Use the whole hand to support the breast. Think of your palm as a gentle cup, Alternate brief, gentle compressions with stillness so she can sense intention. Watch her breathing and body language. If she leans into you, that's a green light to continue. Tip 4, treat the areola like a dimmer switch. Precision beats force every time. Biology. The areola and the nipple complex have dense nerve supplies. Sudden, rough pressure can trigger pain or numbness. Gradual increases in stimulation allow nerve receptors to respond without overload. Emotion. Approaching sensitivity like a dimmer, slowly increasing or decreasing intensity, keeps things pleasurable and in her control. It says, "I'm listening to your rhythm." Practice. Start with feather-light contact around the areola and gradually vary pressure. If she prefers more, you might increase firmness gently, but always check in with a short question or by watching cues. Avoid abrupt tugs or sharp motions. Tip 5, use breath, voice, and words. Your tone matters almost as much as your touch. Biology. When breathing synchronizes, parasympathetic tone improves and oxytocin increases. Lower, slower vocalizations can soothe and build arousal. Emotion. Whispered praise, low compliments, and short prompts keep her anchored in the moment and reinforce emotional safety. Practice. Keep your voice soft and present tense. Right here. Yes, stay with me. Breathe with her. Longer exhales from both of you reduce tension. Avoid performance-focused comments. Focus on sensations and affirmation. Tip 6, blend with other sensations. The magic is often in combining, not isolating. Biology. Many women experience stronger overall arousal when multiple areas are gently stimulated and when the brain can integrate those signals, sensory convergence. For many, simultaneous external stimulation, such as pelvic or clitoral attention and breast touch together, amplify response. Emotion. Blending creates a fuller experience. It reinforces that you are attuned to her whole body, not just one area. Practice. If she's open to it, maintain supportive breast touch with one hand while the other offers gentle external stimulation elsewhere. If devices are used, keep them discreet, low intensity, and checked for comfort. Tip 7, temperature and texture with caution. Contrast can thrill, but only with enthusiastic yes. Biology. Temperature contrasts can heighten sensory contrast because skin receptors respond to small changes in temperature. However, extremes can cause sensory shock or discomfort. Emotion. Small, consensual contrasts increase novelty and attention, which can intensify arousal if both partners enjoy it. Practice. Try mild, brief temperature plays, warm palms, or cool breath only after a clear yes. Avoid extreme cold or heat. If using oils or lubricants, pick body-safe, unscented products and apply a small test patch first. Tip 8, respect pain. Watch for signs of discomfort. Pain is a boundary, learn it, and you'll be trusted. Biology. Sharp pain, burning, or numbness are signs of overstimulation, friction, or an underlying condition. Persistent soreness may be hormonal, dermatologic, or related to recent exercise. Emotion. If you ignore discomfort, you break trust. If you stop and recalibrate, you reinforce safety and intimacy. Practice. Learn the signs pulling away, sudden, quiet, tensing facial changes. If she freezes or says, ouch, pause, ask a short check-in and adjust. If discomfort repeats, suggest a medical checkup rather than guessing. Tip 9, finish with presence, don't just drop off. The landing is as important as the ascent. Biology. After intense stimulation, the body needs time to come down. Heart rate and hormones stabilize gradually. That aftercare period reinforces neurochemical bonding. Emotion. Holding, gentle, stroking, and quiet words after activity deepen connection. Many women value the decompression as much as the stimulation itself. Practice. After the peak of intimacy, pause. Keep a palm on her, offer water, share a soft kiss, and breathe together. Let her body unwind without abrupt movement or distraction. Biology, what's actually happening? When arousal increases, blood vessels relax and more blood flows to sensory tissues, increasing sensitivity. Nerve endings in the breast, areola, and nipple can respond to light touch or pressure, but they also adapt quickly, so steady, mindful variation is more effective than repetitive force. Oxytocin and dopamine play crucial roles. Oxytocin builds connection and trust. Dopamine reinforces pleasurable anticipation. Both interplay with cortisol and stress hormones. Lower stress equals better responsiveness. Emotion, how this affects dignity and quality of life. Sexual touch can validate a person's desirability and promote self-worth. For many women, positive, respectful touch on the breasts carries meaningful, emotional weight connected to body image and past experiences. When handled with care and explicit consent, it increases mutual respect and deepens relational intimacy, improving overall quality of life and emotional well-being. Practical what you do day to day. Small daily habits lay the groundwork. Affectionate, non-sexual touch during the day, verbal compliments that focus on presence and personality, improving posture and breath to stay grounded, and simple health habits, adequate sleep, regular movement, hydration, and nutritious food, which all support circulation and hormonal balance. Practice presence, put the phone away, make eye contact, and learn to read small in the moment cues. I'm nervous, I'll do something wrong. Perfectly normal. Start with consent, then slow your pace and ask for microfeedback, more or less. Most people respond well to gentle curiosity. She didn't respond, was I bad? Not necessarily. Factors like stress, menstrual cycle, medications, or health issues affect responsiveness. Ask gently later, not during, would you like to try that another time, and never pressure. What if she says she doesn't like breast touch? Respect it. Some women don't enjoy it. Switch to other forms of intimacy and reassure her you heard her preference. Emotional safety grows from being flexible, not offended. Part of being a great lover is being in good physical shape. Good circulation and cardiovascular health improve stamina and control. Here are evidence-based, practical steps. Move regularly. 30 minutes of moderate activity most days helps circulation. Walking, cycling, or swimming are excellent. Pelvic and core work. Simple pelvic floor exercises help control and endurance. Sleep and stress. Adequate sleep and stress reduction improve hormonal balance. Nutrition. Hydration and foods high in nitrates, beets, leafy greens, and antioxidants support vascular health. Supplements. Some men use supplements that support circulation, like citrulline, watermelon extract, or proprietary blends aimed at stamina. If you consider supplements, treat them as supportive, consult a doctor, particularly if you take medications. Supplements are not quick fixes. They work best combined with lifestyle changes. If you're over 40, 50, or 60 and worried that ache, performance, or changes mean the end, I promise they don't. In many ways, you're better positioned now, more experience, better emotional intelligence, and often less urgency. Those things make you a better partner. The men I work with often tell me their most satisfying intimacy came later in life when they learned to slow down and listen. Day 1. Consent practice. Ask a partner one short question about preferences and agree on a safe word or code. Day 2. Breath sync. Spend 5 minutes sitting back to back and breathe together.